Have you been diagnosed with type 2 diabetes? Or did you receive news that you are at risk of it? Whatever your case, you will find the best ways of reversing the disease here. Over the years, type 2 diabetes has risen to epidemic proportions. Statistics have shown that there are 3.9 million people living with diabetes, and type 2 diabetes covers 90% of that. While the disease is incurable, there are proven ways to reverse its effects. Through certain measures, you can attain and maintain normal sugar levels even without medication. Reversing diabetes simply means making long-term efforts to effectively improve insulin sensitivity in people who have type 2 diabetes, and here are some of the best ways to do just that. 1. Implementing a low-calorie diet into your meals. This is a method of consuming more foods that contain low amounts of calories while avoiding those with high calorie content. Before it can be called a low-calorie diet, it must contain only around 800 to 1200 calories daily. This method usually has to do with replacing your meals with soups, shakes, or normal foods in little portions. The most common way of using this method is taking the shakes or food for a period of 12 weeks, then gradually employing back normal and healthy food. Cells of people suffering from type 2 diabetes usually suffer abnormalities, sometimes even causing cessation of activities in general, hence becoming dormant. In the past, it was concluded that these cells were permanently damaged, but recent researches have shown that certain cells could actually be saved. One of the ways of saving these cells is through low-calorie diets, which is a rather extreme method, but it effectively causes remission of blood sugar levels or simply returns your blood sugar level back to normal, exempting the need to take medication. In reversing type 2 diabetes with this method, you will need as much help as you can get from your doctor, dietitian, other professional healthcare workers, and even people around you. Make sure you work with a professional who helps control the amount of calories you eat. According to data gotten from several pieces of research, very low-calorie diets have significant effects on diabetes. It was also proven that about half of those who participated in diets had their diabetes reversed and their blood glucose maintained for at least 6 to 12 months. Apparently, the majority of the people who experienced successful diabetes reversal also lost at least 30 pounds and didn't have diabetes concerns for as long as those who weren't successful. Although this is a very effective method of reversing type 2 diabetes, it isn't for everyone. Before you begin, it is a prerequisite that you talk to your doctor first. With this, you not just confirm that it is safe for you, you also receive the guarantee that it can work for you. 2. Bariatric surgery. This is also known as weight loss surgery and is done by changing the stomach and digestive system to set a limit on how much food you can eat. This method is very effective for shedding weight and has also been associated with the reversal of type 2 diabetes in other ways. In fact, with this method, you are likely to see positive results even before you experience weight loss. It is also believed to alter hormones in your system to help control blood glucose. After the surgery, which is very common for losing weight, is done, the small intestine begins to produce molecules that assist the body in the usage of glucose. Interestingly, these molecules are normally found only in the small intestines of a fetus, but never present in adults. This appearance is most likely caused by the fact that the small intestines become subjected to more duties and have to work harder. For instance, more work will be required to move food down and to absorb nutrients. Also, it can be related to the fact that the stomach is bypassed, causing the need for more mechanical stress to take food directly to the intestines. Obesity is known as a common risk factor that causes significant development and progression of type 2 diabetes. Therefore, weight loss is apparently a key factor in its reversal. Since the bariatric surgery causes remarkable weight loss, the role it plays in the regression of the effects of type 2 diabetes is very important. The surgery enhances insulin sensitivity, increases insulin secretion, and enforces caloric restriction, ultimately restoring glycemic control. Studies prove that more than 75% of bariatric surgery patients have their diabetes reversed. This option is, however, only effective when your BMI is at least 35. It is also best effective for those who have suffered from the disease for at most 5 years and do not use insulin. If you're considering this option, you should definitely talk to your doctor because, well, it's surgery. And even though the majority of those who have done it have seen positive results, there are still serious risks attached. 3. Exercises and workouts. Exercises and workouts also assist the body in reversing type 2 diabetes by making it more sensitive to its insulin and reducing its demand for insulin, making it very effective in diabetes reversal. As we have seen earlier, weight loss is the most important factor for the reversal of type 2 diabetes. This is because excess body fat has a negative effect on the production and usage of insulin, hence promoting the disease. Employing the right exercises will allow you to successfully lose significant weight and regress the disease's effects. As the saying goes, you can't outrun a bad diet. This is very true in this case, as you must combine your exercises with a healthy diet before you can achieve the best results. There are many exercises and workout routines to follow, but if you don't have one, you can simply start with walking. It is very easy and you only need a pair of shoes to begin. Walking was one of the most recommended activities for people diagnosed with type 2 diabetes. Brisk walking for about 30 minutes daily for 5 days weekly can help you achieve good results. Weights training is another good alternative. Develop a plan for resistance exercise or weight training for at least twice a week, and you have developed a very effective way of dealing with type 2 diabetes. A good routine should include free weights, bands, or machines, all with challenging resistance. The best results can be achieved by doing 2 to 3 sets of 8 to 12 reps for every exercise. Yoga is one very effective activity that reduces stress and controls blood sugar. If you are diagnosed with type 2 diabetes, yoga is highly recommended as it reduces stress and helps manage your condition. This is because the higher stress level is related to higher sugar levels, making yoga very effective in backtracking the disease. Tai Chi has similar effects as well. According to studies among those who have been diagnosed with type 2 diabetes, the majority, or about 67%, can actually reverse the disease just by employing a good 6-month diet and exercise program. 4. Total abstinence from smoking. Quitting smoking before being diagnosed with diabetes is a definite advantage for you. But if you have already developed the disease, it's not too late. Quitting makes it a lot easier to manage your condition. As we have seen, type 2 diabetes is heavily linked to insulin resistance, or the failure of your cells to respond to the hormone known as insulin. This hormone is produced in the pancreas to allow glucose to enter your cells. When insulin is not used properly, sugar accumulates in your bloodstream, causing abnormalities. It is a well-known fact that smoking increases the risk of heart disease and cancer of the lungs. However, this act is also responsible for insulin resistance and hence type 2 diabetes. The risk of type 2 diabetes can be increased by smoking in several ways. Cigarettes contain chemicals that are capable of causing severe harm to your body's cells and severe interference in their normal functions. Smoking causes inflammation in many parts of the body and decreases insulin's effects. Also, the mixture of oxygen and cigarette smoke causes a reaction that damages certain cells, which also increase the risk of diabetes. Studies prove that people who smoke have a 30 to 40% increased risk of developing type 2 diabetes than those who don't. It also makes the management of the disease a lot more difficult. Permanently quitting smoking may be difficult, but it is very possible and will be good for you at any age. The sooner you quit, the better it will be for you, because your body will start to heal. Studies have even proven that insulin becomes much more effective in lowering sugar levels after just 8 weeks of quitting smoking. To quit smoking, make use of products like nicotine patches or nicotine gum, or apply for cessation programs. If you do not smoke and you are diagnosed with diabetes, it is extremely important that you stay clear away from smoking. If you already smoke and have the disease, contact your doctor for more options. telephone quit lines are also a great alternative, as you can get help from more specialized experts. 5. Fasting and careful selection of regular meals. Going without food or drinks with calorie contents over a well-planned period helps significantly in the reversal of type 2 diabetes. This is a very practical and straightforward method of weight loss. Those who have experienced adequate weight loss have a decreased level or amount of fat in their liver and pancreas. It also leads to the functioning of beta cells in the pancreas, which releases insulin and controls blood sugar. A very effective program of fasting for those looking to reverse diabetes contains 3 24-hour fasts weekly for a few months. Only dinner is to be eaten on days of fast and only lunch and dinner on other days. The main focus should be on low-carb meals. Studies show that following this routine can make you lose adequate weight and reverse the effects of the disease. Alternatively, eating very little calories, say about 500 to 600, twice a week while maintaining a regular diet on other days can also aid in weight loss and the reduction of blood sugar levels. Also, when selecting regular meals, ensure to include high-quality proteins and fat in all your meals. They play important roles in the stabilization of blood sugar and the promotion of fullness so you don't overeat. It is also very important that you sit at a table while eating, as being too comfortable, e.g. sitting on a couch and watching TV, can lead to mindless eating and hence overeating. Sitting and focusing on your meals helps consume just the right quantity you need. Before fasting, it's a prerequisite that you contact your doctor for advice and support. Diabetes is a very deadly and incurable disease. Making use of all the aforementioned steps does not guarantee you getting completely cured. It may keep your sugar level in a healthy range without medication, but there are chances that symptoms will still return. However, there is a higher chance that you will go for years without having trouble controlling your health concerns due to the disease. In conclusion, sticking to these steps makes it possible for type 2 diabetes to be reversed while giving off very exciting results and boosting your overall health without too much stress. Click the link below this video to discover the one common veggie to avoid that spikes blood sugar levels.